It's really exciting. The Lymphoma Research Foundation Adolescent Young Adult, or AYA, Consortium is a really incredible initiative, and it's one that's been underway for almost 10 years now. The thought and the need came up in 2015 that these are younger patients defined by ages 15 to 39 years of age, and one that many unmet needs to address when we think about and talk about AYA lymphomas. I always say that the Lymphoma Research Foundation is the ultimate convener of bringing together like-minded experts, but really experts and people from different disciplines. And we know really for any issue, any cancer, any lymphoma in this case, it takes different experts from a multidisciplinary setting to address those problems. And when we think about AYA lymphomas, there are many different subtypes, and you need all different experts, whether we think about etiology, what causes the different lymphomas, epidemiology, what are the different factors associated with it, the diagnostics, the science related, what about all the different treatment options? And then yes, there are different treatment options, and thankfully many patients are cured. What about the survivorship, the late effects? And then overarching all of that are socioeconomic issues and disparities that need to be addressed as well. There's a lot of favorable downstream benefits to patients and also to providers and scientists, because there are so many issues. It's a really unique initiative, unlike some of the other ones that the Foundation has spearheaded, like mantle cell lymphoma or follicular lymphoma. There are multiple different subtypes when we say AYA lymphomas. Now, the most common are Hodgkin lymphoma and diffuse large B-cell lymphoma and a few others. But you have different subtypes of lymphoma, number one. And number two, and this is a really critical issue to address, is there's an overlap amongst pediatric oncologists, who historically will treat up into about 30 or sometimes beyond age 30, and adult oncologists like myself who treat starting at age 18. So prior to this initiative, we were pretty much viewing and designing research and clinical trials on somewhat different islands. And what did the Lymphoma Research Foundation help do is bring that together and really form one large continent for us to work together and plan research and educational initiatives together. It's really important to have a consortium and a workshop meeting on AYA lymphomas, partly because there's so many issues to be addressed and different specialists to bring together. That's number one. Number two, we hope this meeting will not only highlight the really important unmet needs, but how do we prioritize what can and should be addressed first, and how do we address it? Is it different clinical trials? Is it the etiology, epidemiology? Is it the survivorship? And then how do we improve it? Is it through clinical trials? Is it through educational initiatives? Is it through white paper research? So that's what we will continue to do and enrich that process, and hopefully come out in the end of an even more distilled roadmap for us to address for healthcare experts, patients, and their families. Yeah, there's a lot of excitement in the field of AYA lymphoma, and the Lymphoma Research Foundation has had a really strong guiding hand in this. And top of mind is really some of the new treatment options for patients, and I'll give Hodgkin lymphoma as an example. As I had alluded to before, for the preceding multiple decades, at least in the field of lymphoma, pediatric oncologists were on one side and adult oncologists doing our own research. So, as you can imagine, when you come together, not only is there great, brighter ideas when you're around a table and Zoom meetings working together, but you're able to conduct that research faster, because especially if it's a clinical trial, if you're working together versus separately, it can happen in a couple years versus many years. And one real great example is a clinical trial that the Children's Oncology Group, at the time led by Dr. Kara Kelly, and all of the adult cooperative groups as part of the National Cancer Institute led by SWOG, a clinical trial called S1826. So it was for patients ages 12 and above, so down to 12. Normally when we were doing an adult clinical trial, we would not have gone below 18 years of age. So we started at 12, there was no upper age limit. And that clinical trial finished more than a year ahead of time, number one. And number two, it was an impactful result incorporating checkpoint immunotherapy to the frontline setting, and was published in the New England Journal last year, led by Dr. Alex Herrera, a new scientific advisory board member. The senior author was Dr. Jonathan Friedberg, also a Lymphoma Research Foundation scientific advisory board member, and frankly, in my opinion, established it as a new national, if not worldwide, standard of care. Historically, yes, these lymphomas, whether Hodgkin lymphoma, diffuse large B-cell lymphoma, had been treated very differently. And as we've been talking, we're coming much closer together. And not to say it'll always be identical for the pediatric or the adult, but I think the more we can come together, it'll be easier and more digestible for patients and for providers. But we still have to be mindful of ages of patients, and there's so many important factors, not just socioeconomic, but these are young adults. You know, whether just graduating college, have their first job, are they coming off their parents' insurance? So there's all those socioeconomic factors too that we have to be very mindful of, in addition to hopefully making sure every patient has access to the latest and greatest treatments. It is somewhat more complicated for AYA patients after they finish treatment. Of course, we hope we finish the treatment, it's novel targeted treatment, they garner a complete remission and hopefully are cured. So that's great. But patients, if you, as you could imagine, are in your 20s and were treated with chemotherapy, maybe some new novel targeted agents, well, they have another multiple 5-6 decades to live. And are there some what's called post-acute or late effects from the treatment? Whether increased risk of heart disease, lung disease, kidney disease, psychiatric and other, yes. And that's another really important item we have to address. There are multiple current different guidelines out. Which one do we follow? Not really clear, and I think that's something that we're willing to take head on, is can we harmonize some of these survivorship guidelines to help patients and providers?